Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Tooth injuries are quite common in children and can occur during play, sports, or accidents. Understanding how to handle these situations is crucial for parents, as timely intervention can make a significant difference in saving the tooth and preventing long term damage. So join us as we explore the steps to take when faced with a tooth injury, aiming to equip you with essential knowledge to protect your child's dental health and well being. Welcome, everyone. I'm Dr. Somya Saluja from THIP Media, and today we are here to discuss the significance of managing tooth injuries in children and to help us navigate the complexities of this common yet crucial dental emergency. We have with us the distinguished pediatric oral health expert, Dr. Laresh Mistry. Dr. Laresh Mistry is a highly accomplished pediatric dentist with over 14 years of clinical expertise, specializing in comprehensive dental care for children from infancy to adolescence. As a senior consultant in pediatric dentistry, Sir excels in advanced pediatric dental procedures, ensuring that his young patients receive the highest standards of care. His clinical work is distinguished by a compassionate approach, creating a positive and comfortable environment for children undergoing dental treatment. In addition to his clinical practice, Dr. Mistry has over 9 years of academic experience. Sir is an associate professor at Bharatiya Vidyapeeth Deemed University, where he plays a pivotal role in shaping the future of pediatric and preventive dentistry. Dr. Mistry's dedication to teaching and research is reflected in his significant contributions to the academic growth of dental professionals. His ability to integrate practical experience with academic insights bridges the gap between theoretical knowledge and clinical application, benefiting both students and patients alike. Dr. Mistry is widely recognized for his commitment to excellence in both clinical and academic fields, continuously advancing pediatric dental care and education. Dr. Laresh Mistry, TIP Media welcomes you, sir.
Thank you.
Thank you, sir, for your time today. Sir, we all understand that a tooth injury, it can be a very distressing event, especially for parents, who feel overwhelmed in that particular moment. Yet many may be unsure about how to respond, effectively, or they may fear the possibility of long-term damage to their child's teeth. So to help bridge this gap in understanding, I'm going to start this discussion with the most fundamental question that what are the most common types of tooth injuries that you have come across or you generally see in children?
So, a very good afternoon to THIP Media and the team that is taking a lot of care and attention towards common problems in India and for the Indian population. So, coming to the question that you've asked, for the commonest type of injuries that we've seen across in children. So, the answer can be divided into two parts. When we look at younger children with milk teeth, or as we call them as primary teeth in scientific literature, so milk teeth are more prone to displacement type of injuries. That means the
Okay.
moment of the teeth is affected. So the teeth may be positioned a little to the front towards the lips, or it may move towards the palate. It may move inside, or it may come outside. So this is the most common varieties of injuries that we find in primary or middle teeth. Whereas in young permanent teeth, the situation remains fairly similar because the roots have not completed. The bone is a little soft. Whereas when we go to more mature or more older children, the types of injuries are more fracture oriented. So you'll find more fracture related injuries in individuals which are a little older, whereas displacement type of injuries in children which are a little younger.
Okay, right. And how should parents and caregivers handle a child dental emergency, which involves a tooth injury? What I mean is that what immediate first aid measures should be taken if a child chips or knocks out a tooth?
So at the first instance of an injury, it is important to ascertain whether the injury has occurred in front of the parent or the parents were not at the site of injury. Because
Right.
if the parents were at the site of injury, they can actually recall. what event exactly happened.
Right.
And first and foremost, you also try to find out if there is any associated damage other than dental problems.
Right.
So try to find out if there is any neurological involvement. The face being a highly vascular, or the blood flow in the face is very high. So if there's
Okay.
an injury anywhere across the face, typically you'll have a lot of bleeding.
Okay.
So first try to arrest or stem that bleeding, and then
Okay.
try to assess the potential injuries that occur in the mouth, and immediately try to just be calm and calm the child down, and then you can start looking at the dental injuries. So what the question that you've asked is from chipping of the tooth to missing tooth. So these are
Yes.
two possible extremes in the types of
Okay.
injury that we encounter. A chipping of the tooth will not be a significant dental damage because you can sort of restore it or reattach the fragment that is broken off. Whereas the tooth loss is something which is more grave. So tooth loss at the time of injury, if you have the tooth, it is very important to conserve the tooth and get it back to a qualified dentist. And then we can institute remedial measures. So as I told you, these are two extremes. And the first rule in assessing any injury is to see what are the associated factors that can complicate the problem. So get
Right.
the tooth back to the dentist in case of the most extreme form of injury. And it is important to stay calm. And yes, most of the times the parents go to a pediatrician, which in this instance will not be of much use. So it is important
Right.
for parents to understand that a dentist is a sort of a person that is qualified to tackle such problems rather than a pediatrician.
Okay, right. And like you just mentioned, that the parents should be aware of the fact that they have to take their child to a dentist, a well-qualified dentist, preferably a pediatric dentist. So, how do dentists determine the severity of a tooth injury in a child if the parents, bring the child to them?
So, whenever we sort of want to assess the amount of injury and the extent of injury, we look at three possible pillars. First pillar
Okay,
is the history taking. As I told you, it is imperative for us to understand whether the parents or caregivers were at the site of injury. If they were
right.
at the site of injury, they can give an appropriate history, which is very, very crucial to our diagnosis. But if the child was alone or was unattended, then the history taking is a little bit tricky because children are very poor history givers. So
Okay,
after the history is taken adequately, the second step is clinically examining the tooth. So once we
okay,
examine the tooth, there are different forms of injury, as you've already told, cracking of the tooth or missing a tooth. But also there are certain aspects of soft tissue injury. So there may be
okay,
some injury to the soft tissue, such as maybe the on the face you have highly vascular area. So it may be to the lip, it may be to the cheeks, it may be to tissues inside the mouth. So history taking के बाद clinical examination to check करना चाहिए कि मुंह में कितना डैमेज हुआ है, whether bleeding is there or not. Stop that bleeding, arrest that bleeding, and then it will be possible to explore the different injuries that are there. And the third, obviously, is the investigations. So we have to go a little further, take a few X-rays, and also determine whether there is jaw fracture. If there's jaw
okay.
fracture, it is even more important to first assess the fracture of the jaws and then attend to the teeth. So these are three important things which help us determine the extent of injury and then come to an appropriate diagnosis and then, of course, institute a proper treatment plan.
Okay. And now talking about the treatment plan, what would you say are the treatment options available for different types of pediatric tooth injuries?
So again, this question will it's the answer is a little bit complex. So when you talk
Okay,
about milk teeth, there are more displacement sort of injuries. And in milk teeth or primary teeth, as we call them, uh, the possible ramifications include the damage to the developing permanent tooth. So
right.
most of the times, if I were to talk to laymen or common people, injury to milk teeth will have to be addressed most often in removing that tooth because there is a possibility of permanent tooth which may get damaged. In case of teeth that are young and permanent, we look at conservative options because there's a lot of blood flow in the tooth which will help in healing those sort of injuries. So we look at conservative treatment options when the teeth are newly erupted in the mouth and have yet to complete their complete development. And in case of teeth or individuals which are a little older, say ranging between the age of 9 to 12, we may institute more radical treatment options, much like root canals. And again, the other two factors which will determine the type of treatment is the two tissues that are affected. So we may have the nerve or pulp, as we call it, which is injured, and we have the periodontal ligament, or which is the skin which attaches the tooth to the bone. So, in case of damage to the pulp, the only extreme treatment options remains as a root canal treatment, which is not very complicated in the modern times. Whereas in case of damage to the periodontal ligament of the skin that attaches the tooth to the bone, the treatment options are fairly limited because the access to the area which is damaged is limited. And the
Okay.
fate of the tooth will essentially depend on the type of outcome associated with the healing of the periodontal ligament.
Okay. Great. So clearly, what I understand from this is that the age of the child and the stage of the tooth development, they play a very important role in terms of the treatment options which are available. Great.
Yes.
Okay. Now, in case if the parent misses out on a tooth injury, or let's say a child is scared of, telling the parent that, I've been hurt or I've been playing and there's an injury to the tooth or the mouth. So, what can be the potential long-term consequences of such untreated tooth injuries in children?
Yes. So in the milk teeth, I'll again put it into two parts, milk teeth and the permanent teeth. In the milk
Okay.
teeth, the most common sign that is available is the tooth becomes discolored. So eventually, you may find the hue of the tooth changing from say translucent white, which is a normal color. It may go on to yellow, and slowly it will turn pink or black. So this is
Okay.
first obvious sign that there is possibly nerve damage and compression of the nerve, so the blood supply to the tooth is compromised.
Right.
Secondly, if this does not happen fast enough, then you will have a boil on the gums, which will
Okay.
be definitely hurting. So while routine brushing is done by parents in younger children of this age group, you may find a little bit of a swelling around the gums, which is called as an abscess, and that may discharge some amount of blood or pus. So again, that is something that you can relate to when you are taking care of the child. And as I told you in milk teeth, the potential long-term consequence is its impact on the developing permanent tooth which is there in the jaws. So
Right.
yes, as I told you, children are very poor history givers. So because of the fear of
Yes.
dental treatment and the dentist himself, they might not report.
Yes.
But
Yes.
on routine examination by the parents, it's always important. And these injuries commonly occur in the front of the upper jaw. So what we
Right.
call lift the lip, which is a
Okay.
common technique. So you just lift the lip, and there are
Okay.
some potential answers that you can get in terms of such teeth. And in case of permanent teeth, let's go to the most extreme. That is, suppose that the tooth is lost and you have the tooth in hand. Then when you place the tooth back, there are certain indications wherein literature or studies or research doesn't advise us to put the tooth back. But
Okay.
prosthetic replacement options, when you have the tooth there missing, are fairly limited because of the stages of growth and development, because of the
Right.
position of the other teeth, which is not yet fixed because the child is still growing. So
Yes.
you can't do
Yes.
something which is fixed. You can't do a bridge. You can't do an implant. So potential treatment options are limited. So even if you understand that the treatment may fail by putting the tooth back there, it is prudent to just keep it for as long as possible till the body completely rejects it. So there's
Right.
no harm in doing that, and treatment options definitely will improve as the child ages, and will also preserve importantly the quality of bone that is there around the
Right.
missing tooth, which will help
Okay.
immensely in the future.
Okay. Right. And now about the timing. Now, does early intervention play a role in preventing these complications that you've just mentioned in context with the childhood dental injuries?
Absolutely, time is a golden factor. So
Right.
let's again talk about avulsion, which is missing tooth. So whenever
Yes.
there is a missing tooth and you have the tooth in the hand, if you put it back within 20 minutes, now of course there
Okay.
are various factors which determine whether the parent can do it or not, or if you're close to a dentist, then time is of very valuable essence. If you put it back immediately, then you have greater chances of the tissues, that is the pulp or the nerve and the skin around the tooth or the periodontal ligament being vital. So
Okay.
once these are vital, the chances of the tooth staying there are much longer. So research
Right.
suggests that within 20 minutes is ideal, but yes, up
Okay.
to 60 minutes could still be considered favorable.
Okay.
And however, there are different type of injuries such as a crack, which is close to the nerve. So
Right.
sometimes delayed treatment option is also considerable because the pulp or the nerve at times is in the state of shock, so it does not
Right.
really respond to assess the type of injury or the extent of injury. So in such situations, it is prudent to do some temporary treatment and then go for long-term treatment, which is best in the interest of the child, in the best interest of the child. So some injuries will warrant taking some time off before you institute the final treatment, and some will want immediate treatment to be done.
Okay.
But
Right.
nevertheless, a visit to a dentist as early as possible will help you determine the type of extent of injury.
Okay. Right. And now I'm going to ask about the parents to know because I suppose prevention is always better than cure. And these days, parents are getting busier. The kids are usually alone to give them a proper history for any injury in any form. Right. So, how can such parents promote dental health and safety to prevent tooth injuries in their children?
So first and foremost, you visit a dentist since the child's birth every 6 monthly. So the moment the
Right.
first tooth erupts in the oral cavity, it's important that the child visits the dentist. And after that, every 6 monthly, because we are not just looking at the injury from the aspect of child falling down or during sports activities, but the impact of dental decay, which weakens the tooth,
Right.
and that
Right.
can potentially impact the type of trauma and the outcome that is associated. So a six
Right.
monthly visit to a dentist, proper brushing, and maintaining good oral hygiene, and also use of mouth guards, which is important when you are playing contact sports. As you already told that parents are getting busier by the day. So children
Yes.
are now involved in more and more of outdoor activities, sports activities. They may be going to sports classes. In such instances, it is important for them to follow preventive measures such as the use of a mouth guard. There are different
Right.
mouth guards that are available in the market, but don't fall prey to these commercial mouth guards. It is always important to have them customized. So a
Right.
customized mouth guard is the best protection against a type of any type of dental traumatic injury. Any
Okay.
injury that can happen as a result of falling down or during sports or during children playing is potentially preventable with the use of a customized mouth guard.
Okay. Right. And now, from your experience, what would you say are the current or recent best practices or guidelines for managing childhood tooth injuries?
So the most common guidelines that we as pediatric dentists follow are the International Association of Dental Traumatology guidelines. These
Okay.
guidelines are revised quite frequently, and now we have a lot of research that is going on dental traumatology. So the dental injuries that happen as a result of the factors that we have just mentioned will
Right.
have different factors which will control, which we've already outlined before. So depending on the age of the child, depending on the type of the tooth that is affected, whether the milk tooth or the permanent tooth, depending on whether the tooth is there in the mouth, is it displaced or is it fractured, we have different treatment options. Now, again, talking about the most severe form of injury, that is the loss of the tooth or avulsion type of injuries, it is
Right.
important for the parent to understand that after the injury, the tooth needs to be cleaned. Immediately, if
Right.
the tooth pops out, clean it under running water. Make sure visibly all the debris has come out.
Okay.
Secondly, always hold the tooth by the crown. So there are two parts of the
Okay.
tooth. One which is in the mouth and is visible, which is called as the crown, and the other part which is inside the bone, which is not visible, which is called as the root. So when you
Right.
hold the tooth by the crown, you minimize the damage that could potentially result on the root, which will help in attachment of the tooth later. So always hold
Right.
the tooth by the crown, and sometimes it is not possible for the parent to put the tooth back inside the socket. So you can keep it in an appropriate medium. The most common and readily available medium is milk. We
Okay.
would obviously prefer cold milk because that will maintain the vitality of cells, and you can put it in that milk with a closed container and get it back to a dentist. So
Right.
that is how they will maintain the vitality, clean, assess damage, put the tooth back, and then we splint the tooth in the position.
Okay.
It is important to position the tooth where it was originally. Now,
Right.
sometimes the complication arises when the children do not have perfectly aligned teeth. The teeth are
Right.
a little, misoriented. So in such a situation, a previous picture of the child with the normal complement of the teeth as they were will give us a good reminder of how the position of the tooth has to be. And of course,
Right.
X-rays are there which will help us even determine further the appropriate position of the tooth. So
Right.
chipping of the teeth can readily be remedied with the help of a dental restoration, a tooth colored filling, and the most extreme, that is the tooth loss, can be remedied in the essence of the time if it is brought in the conditions that I just spoke of.
Okay. Right. So I'm just going to summarize this wonderful session by one final question that can you help us or can you provide complete checklist that parents should keep in mind when their child experiences tooth injury?
So the checklist goes in the first. The first is to take an appropriate history, reassure and
Right.
calm the child. Because at times I've seen the parents and children both are in panic, or at times it has even happened that the children are relatively calm, but the parents are, you know, in a panic mode. So first and
Right.
foremost, just calm down, assess the situation, arrest the bleeding. Because as I told you,
Right.
the facial area is highly vascular, there's too much blood supply. So
Right.
arrest the bleeding, and if the tooth is out, keep it in an appropriate medium, clean the area with clean water, and if there is injury to the soft tissues, apply a cold compress. an ice pack or something similar can be applied in the area which is damaged. Do not attempt to remove anything if which is
Okay.
affected as a result of the injury. Do not try to remove any bits or pieces which are stuck in the lip or cheek. The dentist will be
Right.
in a better position because you do not know the extent to which they have been embedded in those soft
Right.
tissues. So,
Right.
and with all of this, immediately rush to a dentist. And
Okay.
once you rush to a dentist, the treatment will be instituted. And after the treatment is instituted, it is important, very important to maintain frequent follow-ups. So if you do
Right.
not take up the initiative of doing regular follow-ups, then you might lose out on key interventions that can be carried out at different time points in the scale of or the timeline of injury. So frequent follow-ups, and as I told you, prevention is better than cure. You have also outlined that. So judicious use of mouth guards during sports activities or while children are playing in the parks. So use of mouth guard is an important thing that parents should look at.
Okay. So a calm mind, an accurate history, on-time examination, and prompt treatment, right? Treatment modalities which have been followed by a pediatric dentist, preferably. So, on that wonderful note, I really appreciate your presence with us today, sir. And we're hoping that the enlightening information shared will be valuable to many families. So, thank you so much for joining us. It's really, really been a pleasure. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates.